a Majora? Damn, girl, how many pussies you got?
I'm a doctor who has so far treated hundreds of women with gynecological cancers. Some people are saying that this med student is just making a joke and hey, it's not that deep. But the history of obstetrics and gynecology is that deep, and it has a dark side. No individual doctor in 2026 can or should shoulder the burden of this frankly horrific history. But to ignore the history and current day inequities of the profession you've chosen is reckless. Some people would tell me that I just don't have a sense of humor, and that's okay. Most of my content is actually very unserious, but if I'm just some rando showing up on your feed, you wouldn't know that. But if you are a woman who is watching this video because you saw the original video and you felt belittled by someone making a joke in the healthcare space about what is already an invasive and dreaded experience, let me share 3 strategies that I use to make pelvic exams more comfortable for my patients, and you can request the same of your doctor if you feel it would be helpful to you. First and foremost, topical lidocaine. So before introducing the speculum, I place topical lidocaine into the vagina and let it sit for a few minutes to allow the area to become numb. Second, I have multiple sized speculums, and I assess the correct size for each patient by doing a very gentle gloved finger exam. Third, I make sure that the majority of the time I spend talking with the patient, when we're going over her diagnosis, treatment options, side effects, any questions she's arrived with, that she's dressed in her normal clothes during that time. I know that when I'm the patient, I feel a lot more comfortable when I'm not half exposed in a gown, so that's the least I can offer for someone who might be having her 3rd pelvic exam that week by different specialists while reeling from a cancer diagnosis. Healthcare has a dark history, and patients come to us in an inherently skewed power dynamic. The jokes we make as healthcare professionals don't exist in a vacuum, but if you found this helpful, feel free to screenshot this summary and talk about it with your healthcare provider.